Hi, it's Dr. Tiffany, and today is July 10th, which is Chronic Disease Awareness Day. And I have a unique perspective on the intersection of chronic diseases and mental health and how we need to holistically treat the body from a like stealth infection, toxicity, traumatic stress, trauma perspective. People who have chronic diseases tend to be in the category of unresolved trauma, unresolved chronic stress, lifestyle issues that need to be addressed, and they will often have a kind of a mental health mood disorder piece that travels along with it. And so in my practice, I treat all of these things holistically, and personally have struggled. I've been very honest about the fact that I have struggled with an autoimmune disorder diagnosis, as well as a fibromyalgia, which is a chronic disease diagnosis as well, which is a lot of pain and fatigue and sleep disturbances and so forth. And they all kind of track back to having these unresolved issues deep in the system. So a couple of tips for the Chronic Disease Awareness Day. I want to say 133 million Americans suffer with these different diagnoses. And there is a chronic disease coalition. I'm looking at my computer website for you to look at. It's a .org website. Alzheimer's, which affects 5.5 million Americans. Cancer, which is 21 million Americans. COPD, chronic migraines, diabetes. A lot of times having a high ACE score and then having a lot of those stealth issues that I mentioned makes you way more susceptible. So I want to say, focusing on sleep, trying to get in bed early and get up early, get out and see the sun, making sure you're hydrated, addressing chronic stress in your life and making the adjustments that are necessary to be less stressed, addressing unresolved trauma in your history, doing functional medicine to see how is your gut health. Do you have leaky gut? Is your digestion impaired? Do you need to address just that piece of things? Is there chronic toxicity that you're unaware of? I see it all the time with mycotoxins, which is mold exposure, or environmental toxins, meaning my clients have to clean up their air and clean up their water. Are there dietary changes you need to make? I personally have to exist in a ketosis state and utilize intermittent fasting to address lupus and to keep it in remission. And I have to be very careful with sun safety. Do you need to be on a diet specific to your diagnosis, right? Endometriosis has a different diet than I would have someone be on for diabetes, right? So looking at diet and exercise. I had a doctor's appointment recently, and the doctor was asking me, are you exercising? And I was like, every single day, because it's the only way I've managed the fibro symptoms, as well as put lupus into remission. So are you exercising? That needs to be a huge part of your lifestyle. My clients that have suffered with traumatic brain injuries, dealing with Alzheimer's and brain health diagnoses, migraines, I have them exercising. I just wrapped an appointment with somebody who, unbeknownst to them, had a tick-borne infection that has been causing a lot of their pain. It may have even been passed on in the family. So looking at those deep stealth infections, and here's the takeaway too. Seeing mental health as a clue to something else that's going on, not just a reaction to our environment and our relationships and our life choices, but also seeing mental health as a clue to something deeper and root cause level that's going on, which can include chronic stress and unresolved trauma. Looking at all this to kind of deeply heal these chronic health issues. If you know someone who could benefit from this, please pass this along. Keep in mind the tips that I've shared. And until next time, be well.